Americans are dying every day of a drug overdose. To put that in context for everyone, that's having the equivalent of the death toll on September 11th every 3 weeks in America.
Fueled in part by the addiction crisis and problematic business practices in the addiction treatment field, the National Association of Addiction Treatment Providers announced in August 2017 a new initiative to create guidelines for treatment, which will define best business practices and will include instructional how-to tools. Let's first focus on the current evidence pertaining to addiction, as well as how this disease of addiction is treated. No two addicts are the same, so no two treatment plans are identical. But there are certainly some common characteristics, and we will describe those using current definitions and evidence. The best definition for addiction comes to us from the National Institute of Drug Abuse, which is part of the National Institute of Health. Addiction is defined as a chronic, relapsing brain disease which is characterized by compulsive drug seeking and use despite negative consequences. Medical diseases are diagnosed, and addiction is no different. In order to make the diagnosis, we refer to the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. This manual is published by the American Psychiatric Association, and it lists 11 criteria for addiction. If someone answers positively to 2 or more of these, they are then diagnosed as addicted. The DSM goes on to describe the severity of the disease. 2 to 3 criteria is considered mild, 4 to 5 moderate, and 6 or more is severe disease. The medical literature is replete with examples, not only supporting the disease concept, but also showing that there is a significant genetic contribution to this disease. Assuming someone is properly diagnosed as an addict, what can we do to help them? To treat something means to deal with it in order to relieve or cure it. Remember the definition? Addiction is chronic, so we do not cure it. We treat it to provide relief. Individuals can enter treatment at different stages. For example, a patient might be medically stable and therefore does not require inpatient hospital care. They would begin their treatment at a different point on the list. Also, some treatment centers might alter the care they provide based on the specific characteristics of their patient population. The levels of care are generally well established and accepted within the treatment community. Detoxification, or detox, requires the most intensive medical monitoring and is generally done in a hospital setting. This level of treatment is required for drugs that have a life-threatening withdrawal profile, like some depressants. Alcohol is a good example. It is dangerous for a severe alcoholic to stop their alcohol intake abruptly, the cold turkey method. This can result in a group of symptoms called delirium tremens, or the DTs. An alcoholic can die this way. They need close monitoring and require medication to safely wean them from the alcohol. The medical team can take advantage of this time in the hospital to also address any other conditions the patient may have been ignoring during their active addiction. Drugs like stimulants, opiates, and hallucinogens may not require an inpatient detoxification. Once the individual is medically stable, a decision must be made that keeps the patient's overall safety in mind. Inpatient treatment may be required for those who are acutely ill and not mentally stable enough for discharge from the hospital. This type of 24/7 monitoring is especially appropriate for the severely depressed and those with suicidal thoughts. Serious other dual diagnosis or co-occurring disorders have to be addressed first. If not, it is difficult to achieve any long-term success in treating the addiction. For example, there was a patient who was battling both alcoholism and an eating disorder. She kept the eating disorder a secret. She was treated for alcoholism, but she was unable to stay sober. It was not until she went to a treatment center specializing in addiction and eating disorders that she was able to get well. This example shows how important it is to detail the treatment plan to fit each individual patient. One size does not fit all. The next level of treatment is partial hospitalization. The patient has to be evaluated and stable enough to avoid self-harm and relapse as long as they are receiving help. Physically, partial hospitalization takes place either in a hospital office conference room or a professional building and includes all-day education and therapy, often in a group setting. The patient's time is structured during the day, and there are often evening activities like 12-step meetings. Also, the patient may live in program housing, like a group of apartments maintained by the treatment center. So they are stable enough to live outside the hospital, but still require a closely monitored environment. After a period of time, the patient moves to intensive outpatient treatment. The setting remains the same, but the time spent in treatment activities decreases to half-days. Even though there is slightly less structure, there is still a significant amount of support available through the staff in the treatment group. At this stage, relapse is less likely than before. Some patients are allowed to move back home and even return to work on a limited basis. It's beneficial to have the support of the treatment team during these times of transition. Home and work stress can be addressed as the patient continues their life in recovery. Once the patient has a solid foundation in place, treatment moves to the outpatient setting. Again, treatment activities take place in an office setting and the schedule varies. These patients are stable enough to live at home, and many of them work. Indeed, some patients enter treatment at this level due to various factors like insurance coverage and other life demands. Care is taken to make sure that they have access to the needed support, even though they do not spend time in the other levels we have discussed. Aftercare is a term used for the continuing care that is provided after the patient is discharged from treatment. At this point, the patient has been acutely treated and is ready to embark on a new life as a sober, recovering addict. However, the need for some level of care and monitoring still exists. This level of treatment can take the form of weekly group therapy meetings led by a counselor or therapist. The duration varies from 12 weeks to several years. For example, medical professionals who are also addicts may attend an aftercare meeting made up of doctors, nurses, pharmacists, and other healthcare workers. These meetings give the person a chance to interact with other addicts who share similar challenges and stressors, both at work and at home. Sober living is a term used to describe what used to be called halfway houses. These are homes that have been converted into drug-free lodging. They allow for a slower transition to independent living. If a recovering person has no home, lives alone, or is not ready to move back home for various reasons, they can live in a sober living house for a period of time. This is a safe environment where the individual can live and work while they strengthen their recovery program to the point that they feel comfortable living on their own. Group meetings are held, and residents have responsibilities that contribute to the upkeep of the home. Daily 12-step involvement is often required. Urine testing or other monitoring serves as another layer of safety. Most of these recovering people work during the day. Sometimes moving back home is scary, especially for those living alone or for those with a lot of free time on their hands. Sober living can be a very important part of their transition. Next, let's talk about 12-step meetings. 12-step involvement is advocated by most treatment programs. While not all treatment centers recommend 12-step programs, this presentation focuses on treating addiction when 12-step work is introduced. Alcoholics Anonymous and similar other groups are separate from treatment. If an alcoholic walks into an AA meeting and gets sober, they did not go to treatment. These groups do not charge any dues or fees, and they do not demand that their members do anything. They merely provide a set of suggestions designed to help their members get sober, stay sober, and help others do the same. Wally Cross is a Chicago-based alcohol and drug addiction professional with over 30 years' experience helping addicts, and he consistently observes that those who work a solid 12-step program tend to be successful. In order to understand how AA helps the suffering alcoholic, the 12 steps have to be examined. The 12 steps are a set of suggestions that function as a program of recovery. Generally, the alcoholic admits there is a problem they cannot solve by themselves. They turn their life over to a higher power. Many use God, but atheists and agnostics can function quite well in AA. They simply recognize some power greater than themselves which can restore them to sanity, like the AA group itself. The alcoholic then goes through a process of self-examination as a way to clean house. They make amends to those they have harmed, and, after a transformation into sobriety, they pass on what they know in order to help the next alcoholic. The steps are taken with the help of a more experienced member of the group through a system of sponsorship. These are the general ideas in AA. We have an entire section dedicated to 12-step recovery that goes into much more detail. There are many benefits of participating in a 12-step group. Acceptance is vital to combat the shame that many addicts cultivate. Self-defeating behaviors are identified and addressed. Tolerance and spirituality are taught as ways of life. Many addicts report a bond that forms among members who share common experiences. The individual immediately sees that they are not alone, and there is comfort in that realization. Simplicity is also stressed through teachings such as just do the next right thing. Other benefits include group support, positive examples of how to live with addiction, taking responsibility for thoughts and actions, and spirituality through prayer and meditation. You will find a lot of God talk in AA, but there is no religious bias. All are welcome, believers and non-believers alike. If you have a desire to stop drinking, you are welcome in AA. The same goes for the other 12-step groups. Respect and tolerance are advocated at all times, with the only goal of staying sober and helping others attain sobriety. Remember, it is vital that the addiction treatment be tailored to the individual. So after the acute treatment period is complete, there are other aspects of a recovery program that they may need to rely on indefinitely. These include addictionologists, psychologists, and therapists. Addiction is a family disease, so the family unit needs treatment and time to heal as well. An addictionologist is a physician who has successfully completed additional training in treating addiction. They coordinate medication and recommend therapy. They are like the quarterback for the recovery team. A psychologist trains in a university setting and relies on written assessments. Therapy types vary, and they can be vital for the ongoing needs of a recovering addict. General examples include individual, marriage, and family and child therapy. These sessions help identify unhealthy behaviors and relationships and teach new, sober ways to cope with life's difficulties. Reality testing is an interesting part of therapy which allows the individual to view things as they truly are instead of how they are made up in their head. Also, medication can be vital to recovery. Unfortunately, as we discussed, there is no magic pill to cure addiction. But in studying addicts, we find a significant amount of dual diagnosis. This usually refers to an individual who has at least one other psychiatric illness. Examples include depression, anxiety, sleep disorders, and bipolar disease. These other mental disorders have to be addressed along with the addiction. It can be difficult indeed to get and stay sober if these other issues remain active and untreated. They can serve as triggers for addictive behavior and relapses. Let's talk about several examples of addiction-specific medication that can help someone stay away from their drug of choice. Suboxone contains a mild opiate along with a substance that blocks the effects of any outside opiate that is ingested. It can work to wean the patient from heroin or pain medication. It is also used long-term in cases where individuals are at risk of relapse. It can also be an appropriate choice for someone who has chronic pain issues. Methadone is used as a substitute for drugs such as heroin, morphine, and other semi-synthetic opioids. Although it must be prescribed by a doctor, it is not a cure for addiction. Naloxone is the non-opiate half of Suboxone. It can be used alone to block any opiate that enters the addict's body. Emergency personnel are being trained to administer it in the field to bring a person back from overdose, for example from heroin. Naltrexone and Vivitrol are also used for the treatment of alcoholism and opioid addiction because they too help to make the effects of alcohol and opiates less rewarding and to a degree help control cravings. Finally, Antabuse is a long-established drug that makes the person taking it sick if they drink any alcohol. For a motivated person in recovery, these treatments serve as a safety net in a comprehensive treatment plan. The point to these medications is that treatment means treating the entire person, and the addict's chance for recovery improves greatly if appropriate medication is available. Now a word about testing and monitoring. If used properly, this can be a valuable tool. When addicts are sick and in the middle of their addiction, they are often unable to be truthful. They may lie to their family, their friends, their boss, and others. Urine testing and breathalyzer monitoring are the only objective proof the recovering addict has that they are not using. Key elements include random timing, observed collection, and chain of custody processing. These elements ensure that the specimen actually comes from the addicted individual and that it does not get mixed up with any other specimen for testing. Does testing and monitoring guarantee the addict will not use because they will ultimately get caught if they do? Unfortunately, no. Actively using addicts typically do not make logical choices, but testing and monitoring protects them, since it can show that they are not using. Very few recovering addicts will refuse testing, especially if it is required by law or for return to work status after treatment. In summary, we have discussed addiction and detailed the various aspects of a successful treatment plan. First and foremost, it is imperative to understand that addiction is a chronic brain disease that can be arrested but not cured. Individuals with the disease of addiction have various needs when it comes to treatment, but there are certain accepted building blocks that fit together to form successful treatment and aftercare. 12-step programs are often recommended and can be an important part of the recovering addict's new life. Although abstinence is required for long-term success, sobriety is much more than not using drugs or alcohol. It is a way of life that values rigorous honesty, accountability, and service. The disease of addiction is progressive and will eventually kill their mind, body, and spirit without treatment. In many ways, addicts are fortunate that they have an opportunity to recover from a hopeless state. Addicts will eagerly agree that without sobriety, they have no chance for happiness. In our experience, recovering addicts are some of the most successful, well-adjusted, and enjoyable people we know.